Hi, good afternoon, Mr. Ibarra. My name is Alyssa and I'll be your nurse today. We're going to be running some tests, okay? Can I please ask you to stand up, feet together facing the wall? We're observing symmetry in the scapula, in the iliac crest, comparing the shoulder height, assessing the relation of the head to the trunk, pelvis, and extremities. We're going to assess the gait. You can stand up, please. And assess the gait and the mobility of your walk, okay? So I'm just going to move the camera this way, just a little bit. And then I'll have you, I'm going to ask you to walk toward the door in tippy toes, please. Good job. Now walk back towards me on your heels. I'm going to ask you to go back, heel, toe, please. Perfect. And do the same coming back. Okay. You're not feeling any dizziness, nothing like that?
No.
Okay. Now step to your right side and your left side. Okay. Thank you. You can have a seat for the next part. We're going to be checking for TMJ. So that has to do with your jaw, the temporal mandibular joint. TMJ assessment, okay? So I will examine the joints of your mouth and jaw. I'm going to be putting my hands on your cheek. Can you please open your mouth twice? Okay, good. Can you move your jaw side to side? Good. Now, can you bring your jaw forward, backward? Can you clench your teeth really, really tight for me? Clench. Smile. Okay, good. So it moves laterally good. It opens and closes smoothly. No spasm, nothing, no pain, correct?
Correct.
And your teeth align correctly in full range of motion. So I'm going to have you stand straight. Can you stand up for me, please? And turn towards the wall. We're expecting the cervical, thoracic, and lumbar section of the spine. We're observing from the side. We observe from the back, observing the symmetry, shoulder height, iliac crest. We palpate the spinous process and the paravertebral muscles on both sides of the spine. And we also test the range of motion of the cervical spine. Can you please turn this way? Touch your chin to your chest for me. Okay, bring your head back up and all the way to the ceiling. Good, now look straight. I'd like for you to touch your ear to your shoulder, whichever one is fine. Then the other one. Good job. Okay, head up and let's do now look to your right. Straight. To your left. Good. Now this time I want you to turn your head to your right and push against my hand. So, okay, good. Now this way. Okay, good. So let's go ahead and continue here. We're going to perform additional range of motion tests. So let me go behind you. Can you go this way real quick? Let me just remove. Step backwards. Can you touch your toes, please? This is to check the thoracic lumbar flexion. Now arch your back. Okay, this is to check for hyperextension. Okay, come up. Very good. Lean to the right for lateral bending and to the left. And now can you twist to your left and to your right? Okay, good. All right. Can you step towards the chair, please? Okay, you can have a seat for now. Right now we're going to just assess the shoulders and the arms for color, swelling, and masses. So I can just check. Compare to assess symmetry, anterior, posterior, inspect the sternoclavicular joint, assess for location at midline, swelling, color, masses, palpate for tenderness. Do you have any tenderness or pain?
No.
No pain here?
Yes.
Okay, no swelling, no heat. First, anteriorly at the clavicle, and we move down to make sure that there's nothing toward the acroclavicular joints, which is in the shoulder, and the subacromial area, frontal shoulder, and the biceps. Okay, so can you have you stand up a little bit, please? Face the wall. We're going to palpate posteriorly at the glenohumeral joint, the coracoid area, the trapezius muscle, and the scapular area. And we repeat on this side. The glenohumeral joint, the coracoid area, trapezius muscle, and scapular area. Okay, thank you. Now we're doing range of motion with your shoulders and arms. Let me know at any moment in time you have any pain, okay? So begin by bringing arms out in front of you. There you go. Now bring them as far back as you can. This is for hyperextension, okay? Relax. Now bring them to your side. Now raise your arms on your side with the palms down, like that, and over your head. And bring your arms to the side. Now can you do this? Okay. Now we're going to inspect your elbows for size, shape, redness, swelling, and deformities. So I'm just checking your elbows here. Can you flex them in front of you, please, like this? We're assessing symmetry. Okay, good. Now relax your arms. I will use my thumb and middle finger to palpate the olecranon process. On this side too. Okay, now I'm going to test the range of motion of your elbow. Bring your right arm up toward your shoulder, like that, okay? Then lower the arm to straighten your elbow, like that. Bring your right arm straight out. Rotate your palm down. This is to check elbow pronation. Rotate the palm up, elbow supination. Now that's this one, bring it out. Rotate palm up. Okay, and you can put it down. This is to check for supination. We'll do it again this time with resistance. So grab your hand and can you pull me in? Okay, good. You're stronger than that. Okay, and that was just to check the resistance. We're going to inspect the wrist for size, shape, color, and swelling. Let me know if you have any tenderness or pain. We compare both for assessment of symmetry. We'll palpate the tenderness and nodules. We palpate the anatomic snuff box, which is a hollow area. Okay, you don't have any pain or tenderness? Next, we'll test the range of motion of your wrist. Bring your hands up, and put your fingers down like this. This is to check wrist flexion. Bring it up. Now, fingers point toward the ceiling. Now straight. Now to the middle. And to the out for radial deviation and straight. Okay, now try to put them up with resistance, okay? Okay, good. Very good. Next, I'm going to feel your hands. Let me know if you have any pain or tenderness. We're inspecting the fingers for size, shape, color, and swelling, comparing and assessing symmetry. Bilaterally palpate each metacarpal, noting tenderness and swelling, assessing the metacarpal joint by squeezing from the hand from the side between the thumb and the fingers, palpating from the proximal to the distal end of each interphalangeal joint, and no tenderness or pain for nodules or crevices. Side. Okay, good. We're going to test the range of motion, so hold up your hands for me, spread your fingers. We will test abduction. Now make a fist to test abduction. Okay, good. Now straighten it out and bend your fingers downward and then upward to the ceiling for hyperextension. Now roll your hand over, palms facing up. Bring out your thumb to test hyperextension. And now touch your pinky with your thumb. Good. Good job. Okay, go ahead and place your, and I'm going to push down, you push up. Okay, good. Now make a fist and squeeze my hands. Okay, good. Put your thumb and pinkies together like this and keep me from pulling them apart. Okay, good. Okay, now we're moving to the hips, knees, ankles, and feet. So we're inspecting the hips for symmetry and shape, palpating the hip for tenderness and stability. Iliac crest is symmetric and high. Hips are stable, non-tender, without crepitus. Now we assist the client into the table in a supine position. And can you have a seat, please? We'll pull up to. Can you pull up your knee to your chest to test range of motion of the hip? Good. Now the next leg. Okay, now straighten your legs out. Now you can roll on your hip joint. So you will be on your side with a straight leg and we will bring it out as far back as you can. This will just check how you have your hip abduction and inward abduction, okay? I will flex your knees in and out. This is just to make sure that your hips rotate without any problems, okay? We now inspect the knees. Size, shape, alignment. Size, shape, alignment, swelling, and deformities. Nothing to see here. Compared to assess symmetry, everything looks fine. Assess for quadriceps muscle atrophy. Then we palpate both knees for nodules and tenderness. Do you have any tenderness? Okay, so we begin 10 centimeters above the patella. Use the thumb and fingers to move downwards. Repeat with palpation with client sitting up. And let me know if you have any tenderness or pain. No? Okay. Client upper and lower legs are in alignment. Knees are symmetric. No swelling, deformities are noted. Knees are tender, non-tender, and cool to touch. Muscles are firm. No nodules are present. Next, with the client standing, we will test range of motion of the knees. Can you please bend the right knee and straighten it out during extension? So bend your right knee. Okay, good. Now bend your left knee. You can just do this too. Good. And extend in front of you for hyperextension. Okay. Okay, good. So we repeat the flexion on the other side. We test for resistance in a sitting position. So can you please sit down? Go ahead and try pushing away from me. There you go. Okay, good. So now we inspect the ankles and feet while you're sitting, standing, and walking. And we just make sure that we don't have any swelling, any tenderness in the ankles and feet. Ankles, feet, and toes are in alignment and no gross deformities are noted. So while you're supine, we palpate the ankle, we assess contour and size, we note any tenderness, swelling, bony prominence, nodules, crepitus, looking also for heat, and we squeeze each foot for signs. We assess the thumbs and the fingers to assess any metatarsophalangeal joints. Okay, we palpate each metatarsal, all 5 of them, then the plantar area. Palpate the toes for swelling and tenderness, any bony prominence, nodules, and crepitus at each interphalangeal joint, moving from proximal to distal. Feet and toes are warm and non-tender to palpation. Now we're testing the range of motion, assessing both feet simultaneously. We point toes upward, now downward, and turn your soles outward and inward. Now rotate feet outward and inward. Okay, good. Bend your toes downward and upward. Okay, good. Client has full range of motion. Bilateral strength is 5 out of 5 against resistance. Now we're going to be starting the neurological exam of the portion of this test, okay? So, Mr. Ibarra, I'm going to say 3 words to you and I need you to repeat them back to me. Ready? Table, quarter, pony.
Table, corner, point.
Quarter.
Quarter, pony.
Okay. Now I want you to remember these words because I'm going to ask for them in a few minutes, okay? Can you tell me what today's date is?
November 20th, 2019.
Okay. Can you tell me where you're located?
Heart and its axis.
Okay, good. Can you tell me those 3 words again?
Table, water, pony.
Good. Time is alert and oriented to time, place, and person. Speech is clear and articulate. Okay, so now we're going to do testing your cranial nerves. Okay, so we have 12 cranial nerves. The first one is cranial nerve 2. Before I get started, let's do something really quick here. We're going to test your sense of smell. Before we begin, do you need to blow your nose for any reason?
No.
Okay, closing your eyes and using your finger to close one nostril. There you go. Can you tell me what this smell is, okay?
Lemon.
Good. Okay. Let me get. Can you do the other side?
Vanilla.
Okay, good. So this is to test cranial nerve 1, which is the olfactory smell cranial nerve. Now we're going to test cranial nerve 2. This nerve controls visual acuity, visual fields, and the ocular fundi. Assessment of cranial 2 consists of tests for near and distant visual acuity, visual fields, and the inspection of the retina and the optic disc, okay? So we're going to inspect the corneal lens, we're going to use the pen here, the light, let me turn it on. So I'm going to come from this side, okay? Okay, good. Okay, can you cover your right eye for me, please? We're gonna be 20 feet away from the Snellen chart so we can test your distant visual acuity. Okay? So can you tell me what this says here?
A, C, J, 9, B, J.
Okay, good. You have 20/20 vision. We're also gonna be, you can uncover it. We like to test also your peripheral vision. So let me know when you see my fingers, okay?
I see. I see. See.
Okay, good. So cranial nerve 3, the oculomotor nerve, 4, the trochlear, and 6, the abducens together control the extraocular movements of the eyes, okay? So assessment for this nerve include pupillary response and accommodation. So can you please focus on my light pen?
Mm-hmm.
Focus on the one behind me.
Mm-hmm.
Focus back on my light pen.
Mm-hmm.
Okay, thank you. Cranial nerve 5, which is the trigeminal, controls the corneal reflex, facial sensation, and jaw movements, as well as aspects of voice and speech. So can you please clench your teeth for me? Okay, now relax. Now I'm going to touch your face with a swab stick. I'm going to need you to tell me if you feel this sharp or dull and where you feel it. Before we begin, this is sharp. I'm just going to test it on your arm. Sharp. And this is dull. Okay? Are you ready? Okay, close your eyes.
Dull. Forehead. Sharp. Right cheek. Dull. Left cheek. Sharp. Chin.
Okay, good. Cranial nerve 6, I will blow some air into your eye. So look straight ahead for me and do not blink. I'm just going to pretend. Okay. Okay, very good. Cranial nerve 7 is the facial nerve that controls facial movements and some speech, and some aspects of voice and speech, okay? So next I'll ask you to look at me, smile, frown, wrinkle your forehead for me, grimace and show me your teeth. I would like you to puff out your cheeks. Okay, now can you purse your lips like you're going to whistle? Okay, now raise your eyebrows for me and close your eyes very tightly. And keep me from opening them. Okay, good. Relax. Cranial nerve 8 is the acoustic vestibular cochlear. This nerve is assessed by conducting the Weber test and the Rhine test. So we're going to go ahead and start with the Weber test. So I'm going to hit this on my palm, put it on top of your forehead, and you let me know when you're done hearing it, okay?
Mm-hmm.
Do you hear the ringing in one ear or both ears?
Both ears and it stops.
Okay, good. So now we're gonna also do the rhyming test. So I'm gonna hit it here, put it behind. Let me know when you stop hearing it.
I stop.
Okay. Do you still hear it?
Yes. It stopped.
Okay, good. So let me do that for the other side.
It stopped. I hear it and it stops.
Okay, good. So, okay, so we did that. Good. Cranial nerve 9 is the glossopharyngeal nerve, okay? Cranial nerve 10 is the vagus nerve. This nerve controls swallowing, the rise of the palate, and the gag reflex. Nerve 10 also controls speech and some aspects of voice. So can you please open your mouth and stick out your tongue and say ah?
Ah.
Okay, good. Now I'm going to touch the back of your throat and you may feel some discomfort. Okay, good. That's your gag reflex. Okay, are you okay?
Yes.
Okay, can you please take a sip of water for me?
Mm-hmm.
Okay, good. Thank you. The spinal sensory nerve controls shoulder and neck movements. I'm going to try push down, so you try to shrug your shoulders up for me. Okay, good. Now I'd like for you to take your cheek and push it against my hand. So puff your cheek out and your tongue and try to push it against me. Not your neck, not your head, just the cheek. Okay, good. Now this side. Okay, good. Cranial nerve 12 is a hypoglossal nerve. This controls the tongue, symmetry, and position, as well as aspects of voice and speech. Can you please stick out your tongue for me and move it side to side? Good. Now I want you to take your tongue and push it against your cheek and into my hand. Okay, cranial nerves 1 to 12 are intact. We will now assess for balance, motor function, and note the symmetry, posture, rhythm, balance, and freedom of movement. Can you please, so we already did the walking to the door, we did the heel to toe, and the walking on your tippy toes, right? So now we want to assess balance. So take a knee. Can you stand up for me, please? Take a knee deep bend on one foot like this. I got you if you feel like you may lose your balance. Okay, up, next on the other side. Okay, good. Now can you hop in place on one leg for me? Okay, the next leg. Okay, now stand nice and tall for me, feet together, close your eyes. If I'll be here if you feel dizzy, okay? This is a cerebellar function assess equilibrium. It is also used in the assessment of the ears. We check for any swaying, and that's what we look for, okay? Okay, open your eyes. Now feet together, arms out in front of you, palms facing up, and close your eyes. And keep me from pushing your arms down. Okay, good. Climb, walk smoothly without swaying, balance is intact. Romberg and pronator drift are within normal limits. Cerebellar function is next to test the coordination. What I'm going to do is take my index finger here and touch my finger, and you touch my finger to your nose. Go a little back. Can you step back? Okay. Can you touch my finger? No, with your finger to your nose and back. Okay, try to do that as fast as you can. Again, keep doing it. Okay, good. Now, can you close your eyes? Okay, good. Good job. Okay, so, and we follow several directions. And okay, let's see. Now we'll check the function of the rapid alternating movements. Can you take a seat for me, please? Okay, so now you're going to take your thumb and touch each finger as quickly as you can. But you have to touch them like this. Okay, good. All right. And now now put your palms down on your lap and then turn them over, back down, and just keep going. Let's see how fast you can do that. All right, good job. So this is the final test of the cerebellar function. It's called the heel to shin test. So with your heel of this leg, go down your shin. Good job. Now the other leg. Good job. Can you now close your eyes and do it again for me? Okay, good. Coordination of movement is appropriate and within normal limits. Okay, we're gonna assess the sense of light touch. So let me know when you feel this little cotton ball and where you feel it, okay? Close your eyes.
Right cheek, left cheek, sorry. Right cheek. Forehead. Chin.
Okay, good. To test pain sensation, we're going to use a point of a broken swab, which I have here. I'm going to ask for you to feel if you feel sharp, okay, or dull. On arm, this is sharp, and this is dull. So now close your eyes and let me know exactly where I'm touching you with and what you feel.
Sharp left arm. Dull right arm. Sharp left arm. Dull right arm.
Okay, good job. Now we will assess temperature sensation. So we can use test tubes filled with cold and hot water. So this is going to be my cold water and my hot water. Okay, so can you close your eyes and just let me know? The pen will be the cold and the, okay?
Hot water. Cold water.
Okay, good. We will now assess vibratory sensation. So we're going to be using the tuning fork. So I'm going to put it on like this. Do you feel that?
Mm-hmm.
Vibration on your right index finger?
Correct.
Okay. We typically test it on the fingers, joints, wrists, elbows and shoulders, toes, ankles, shins, and the sternum, okay? Now I will test precision and sensitivity. I will grab your hand and the finger. This is up and this is down. Close your eyes. Okay, I'm going to go up and down and you tell me where I'm going.
Up. Down. Up. Down.
Okay, I'm going to test your other arm.
Up. Down. Down. Up.
Okay, good. Okay, you can relax and open your eyes. Now we will do the test for stereognosis. I will put some objects in your hand, so tell me what you feel, okay? So close your eyes, and you can use your hand to feel.
Bobby pin. Safety pin, sorry.
Safety pin, okay, good. And what else do I use?
That's all I need.
Okay, good. Very, very good. So the client sensory system is intact using touch, point localization, vibration, pain, and temperature. Position sense intact. Client is able to correctly identify objects that are placed in the hand. The next step is to do the 2-point discrimination test. So we'll use this bobby pin that's in 2. Oops, I dropped it. Okay, that's fine. Don't worry about it. Thank you. So we're going to use this bobby pin that's a bend. So we're going to press both points against the forearm like this. So we're going to begin with the pinched. So you'll probably just feel one like this. And then we're going to be opening it up until, so we begin with the pinch and open the gap until the client, until you can distinguish between the 2 points. So you let me know when you feel the 2 points.
There.
Okay, good. So that is the 2-point discrimination test. So now we're going to assessment of the graphesthesia, which involves the use of a blunt object such as the pen to draw a figure with your eyes closed. So I'm going to get your palm, close your eyes, and let me know what you feel in your hand.
An S.
Numbers.
Oh. 3.
Okay, good. So the 2-point discrimination is intact. The client correctly identifies the number traced on the palm. So first we will test also the deep tendon reflexes. So just relax your arm, palm facing up. We hold arm with the thumb at a crease of elbow like this. And then we check the bicep reflex, which is up here. Lower on the arm is the brachioradius. The triceps on top of the elbow. And then relax your arm with the patellar on the knee reflex, the Achilles reflex, which is the back of the foot, and the plantar reflex, which is down the foot, like this. We will also check the superficial reflexes of the abdomen. Okay, good. The deep and superficial reflexes are 2 plus bilaterally. So this concludes our examination for today. Do you have any questions?
No.
You didn't experience any pain, tenderness?
No.
Okay, good. Thank you so much for your cooperation.